Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today we're going to talk about a serious subject. This is an instance in when you're having back pain in which if these certain symptoms occur, you need to get into the hospital or emergency room immediately. And we're going to discuss that, why it is. But let's first talk about what the symptoms are so you know if you start feeling these, it's time to start the car and spin some gravel and get going.
Yeah, these symptoms are pretty clear.
Yeah.
You're probably not going to have to guess.
Yeah. Okay, first generally it starts off with back pain, but then what happens is you're going to get numbness or tingling in what we call the saddle area. If you were riding a saddle, Brad,
Right.
every part that's touching the saddle,
Right,
that would be numb or have tingling in it.
right.
So
We're talking, in
inner
that crotch
thighs,
area,
yeah,
the bottom where you sit,
your anus, your sexual organs.
right,
And so in addition to the numbness and tingling, now that to me is probably the number one sign or symptom that you're going to be concerned about.
right,
But in addition to that, these are some of the other things you're going to have. You can have some bowel or bladder problems.
loss of control.
Yeah, loss of control or constipation. It
Okay.
could be either way. You're going to have loss of sexual function. You're going to, in addition to that, you might have some weakness in some of the lower extremity muscles, especially the muscles that bring the hip up like this,
Right,
knee out like this, or bring the foot forward like this. Now you might have that in itself, by itself on one thing, and that is a reason to see a doctor, but that's not an emergency. If you have the numbness and tingling in the saddle area,
Right.
which is called saddle, or cauda equina syndrome, then it's a concern. And we're going to explain at the end of this video what is going on and why you need to see the doctor right away. I think we're not yet to the point. If generally the number one cause of this is a disc herniation, Brad,
Sure.
and it's a large one.
right.
And you have a herniated disc or a slip disc, and we're going to show you what that is. And generally what it is occurring, it's occurring at the lower levels here. I'm going to bring it right up here, Brad.
Yep, get a good close-up, Bob.
So these are the bones that make up your back, and these are the lower part, okay, of the vertebrae. Yeah, this actually probably shows better here, doesn't it, Brad?
Sure, yep, this is,
So this is L5, L4, L3, L2, L1. And in between each one of those are the discs. And you can actually see on this red disc where it actually has pushed out a little bit and is pushing on the nerve root. But what these do when it is
cauda equina.
cauda equina syndrome, the cauda equina is this big bunch of nerve roots here. Cauda equina means
Horsetail.
horsetail in Latin. And there's all these nerve roots, and these are the ones that go to all those muscles and sexual organs that we were talking about. So if you get a big disc herniation that hits onto that cauda equina, you can affect all those nerve roots and you can start getting
Right.
problems.
So if we could separate this, it's kind of hard to see, but it's going to be deep in here where a lot of the herniations are on the side of the disc or on the corner, you might say. This is back where it comes
Right
right,
in
into
the central area.
Right into where the spinal cord would be.
Generally occurs at L4, L5, or L5, S1. So Brad's going to demonstrate now how this herniation occurs. Brad, you want to go ahead and get that set up?
You bet.
I'll do some filming.
All right, we're going to get a close-up here. Now what we're going to imagine, as Bob pointed out, L4, L5, the low back, last two vertebrae on the low back by your belt line is where oftentimes this may occur. Here it would be L4, it's just a coffee cup vertebra model. It's a nice cup, works good for this demonstration. This represents the disc, the green ball is the disc, and this is how it would look like when you bend forward, backwards, and move around. The disc is flexible. Now, if you have a herniated disc, now keep in mind the spinal cord and the cauda equina we were talking about goes right through this area. You got that, Bob?
Yep, got it.
Okay, now look what happens if you get a herniated disc. The disc starts to bulge out just like that. And look at the pressure. It's going right into that area of the cauda equina and that central nervous system. It's pushing that, and that's why the functions in that saddle area become all symptomatic. The numbness, the tingling, things are not working properly, and that is not going to pop in typically by itself. You need to go to the hospital and have surgery typically.
Yep, and what they're going to do is they're going to relieve the pressure on that area, and The problem is, what happens is if you don't rush into the hospital, the longer the pressure's on the nerves, you're killing off those nerves.
Sure.
And eventually you could permanently lose the ability for sexual function, the bowels, bladders. I have a patient actually right in this building that we're at right now that suffered from this. You know, somewhat a relatively young man, he was only in his 50s at the time. I think 50s is young, don't
Well, I
you,
think
Brad?
very
Especially
young.
when you become 50. And he's nursing home bound now because he can't walk very well. He's lost, you know, bowel bladder, and he's lost sexual function. So I mean, this is devastating. So this is not something you want to mess with. You get that saddle paresthesias, I want you to rush into the hospital.
You better believe it. If you can't get there, call 911.
Yep. So anyway, if you haven't already, please subscribe to us. We're going to give you lots of videos on how to stay healthy and fit well into your 40s, 50s, 60s, 70s, 80s, 90s.
Right up there,
Right up
Bob.
there.
Take care.
Take care.